Hello, Professor Tovar. It's Melissa Giles. I'm going to go ahead and analyze the hypothetical scenario that you gave us. So here I am. Okay, so in this hypothetical scenario, I am an emergency room nurse, and the EMTs have just brought in a patient. The patient is a 54-year-old woman who is presenting with disorientation and combativeness. She is currently accusing the emergency medical technician team of stealing her purse. She is bleeding from significant scrapes on her arm and her face. And the EMT states that the patient was wandering around a park and yelling at another civilian when she lost her balance and she fell, thus scraping her arm and her face. The patient appears dirty and smells of stale body odor and urine. She is shaking and yelling that she needs a bottle. So based off the current knowledge and assessment, the patient seems to be suffering from alcohol withdrawal syndrome. Since the patient is presenting with confusion, shaking, combativeness, and yelling specifically for a bottle, these are all indicative of alcohol withdrawals. I suspect this patient suffers from alcoholism and is currently detoxing. This patient appears to be homeless and likely has an underlying mental health disease. So, alcohol withdrawal syndrome can be life-threatening. The patient needs immediate care. As her nurse, I would anticipate potential symptoms including tachycardia, fever, excessive perspiration. Sometimes they can get like a red rash on their face. It's not really a rash, it just looks red on their face. Possible auditory hallucinations, nausea, vomiting, headaches, anxiety, insomnia, which could be falling asleep or staying asleep insomnia. Possible tonic-clonic seizures, and in the worst case scenario, we're looking at delirium, tremors, and cardiovascular collapse. So the patient should be immediately evaluated by the physician. My job would be to take her vitals. I would continually assess her vitals and do a physical assessment. I'm presuming that the physician will at least order the CBC, liver enzymes, and electrolyte labs. The patient will benefit from being in a quiet room with moderate to dark lighting. This will help calm the patient, and just persistent reassurance of that you're there for the patient, and whatever I do, I will not entice the patient, or I will do my best to alleviate some of her frustration. It is likely that the patient is dehydrated, so she will receive IV fluids. Most of the time, the physicians will put like 5% glucose solutions in with it, and will add in vitamin supplements. When someone gets dehydrated, usually their electrolytes go down, and they will want to replace like vitamin B1, B6, B12, vitamin C, and folates. The patient will be graded for severity on a CWA scale. So the CWA stands for Clinical Institute of Withdrawal Assessment for Alcohol Scale. It's a mouthful. But CWA is the term that is typically used in the medical setting, and it is a scale for people that are withdrawing from alcohol and who have AWS, alcohol withdrawal syndrome. And it will grade a person based on their symptoms, and it will show like if they're in a mild AWS, moderate, or severe. So when someone's in mild AWS, sometimes they don't even end up staying in the hospital. In her case, it would be questionable because she's homeless, so most likely she would benefit from staying there longer. If the patient is suffering from moderate to severe alcohol withdrawal syndrome, this is when we're getting into the more dangerous situations. They will definitely need hourly CWA checks, along with they usually give benzodiazepines. So the important thing to note as a nurse is that these CWA checks are imperative, because a person who comes in with mild alcohol withdrawal symptoms could quickly go to moderate or severe, or in some cases they can jump down, could be in moderate and go down to mild, just depending on where the patient's at, depending on how long they've been without a drink and the severity of their alcoholism. So it's very, very important that the nurse makes these evaluations a priority, because it could be life-threatening for this patient if they're not getting the proper assessments done. In critical conditions, a patient would likely be in the intensive care unit, and they would be getting anesthetics such as barbiturates or propofol. Those are the most commonly used for AWS. So looking forward for this patient, what does this look like? What is her plan of care? Well, unfortunately, she doesn't have a home from what we know from the information. So I'm just going to go ahead and, for the sake of this, say that she doesn't have a home. She's homeless. Most likely has the underlying mental illness that is untreated. She also most likely does not have health insurance, which makes a plan of care difficult, because what I'd want to do is try to implement her going to get alcohol rehabilitation and things of that nature. So this brings us to our next topic of mental health and health insurance. So unfortunately, mental health patients, including those suffering with alcoholism, do not receive adequate benefits to get the help they need. Most health insurance only cover a small part of mental illness treatment. A large fraction of homeless people are suffering with underlying mental illness. Some feel there is no escape. In fact, a study received showed that 40% of homeless adults were suffering from untreated mental illness. That's a lot. When these homeless individuals were asked about the reason for not obtaining treatment, the main response was due to money or finances, and health insurance, lack of health insurance. Even for Americans that have insurance, their mental health plans typically fall short of being able to get proper treatment for mental illness. For the out-of-pocket and the deductibles are much higher. It's harder to find mental health professionals. It's definitely an area that needs a lot of growth. And onward to that, some people that need inpatient care for alcohol or substance, they can't afford it with most insurance plans. So as a country, it is imperative that mental illness is treated as a disease. Proper insurance plans that cover treatment should be available to those who are suffering. The reality is, the more people treated for mental illness leads to less addiction, because a lot of times people will self-medicate with the substance when they're suffering from mental illness. And then those that are having less substance abuse issues will decrease the amount of overdoses, in this case, alcohol withdrawal symptoms, and will decrease the amount of hospital visits. If insurance companies could manage to allow more coverage of psychological services, it could potentially save money across the entire healthcare system. Okay, let's see. This 58-year-old woman is suffering from substance abuse and most likely has an underlying untreated mental illness. Due to her mental instability, she cannot hold down a job and ended up homeless. This happens way too often in our society. As her nurse, I suspect she will end up back on the streets and back to drinking. It probably will not be her first or last emergency room visit. I will give patient education and supply any resources such as shelters and clinics. If plausible, I can have administration help her apply for access or any other insurance she is eligible for. I will inquire if she has any family that she would like to reach out to, and hope that the experience of having the withdrawals will encourage her to reach out for more help. Throughout the process, I will continually encourage her, let her know that she's not alone. I will take cues from her, behavioral cues, to determine if she's comfortable with me talking to her or not. I'll let her talk to me, express herself, and I will treat her like a person. She is just a person that didn't get the help she needed. She didn't get the health care that she needed, the mental health care. These are things that people cannot control. So I truly hope that there are some changes, and I know that there has been changes lately, but significant changes that help people and prevent situations like this from happening. Thank you.